Hello everyone, I'm Dr. Siddharth Warrior. I'm a neurologist in Mumbai and I'm a content creator who makes content on Instagram and YouTube. Today I'm here to talk to you all as doctors and medical students about a very important topic, finding work-life balance as a doctor. So here is an average day of a doctor. You wake up, hopefully because of an alarm on by yourself, but sometimes because of an emergency call from the hospital. If there is no emergency, you get ready, you have breakfast, and then you leave for your morning rounds. You visit patients at 1, 2, 3 different hospitals, you see them, and then you start your morning OPD. You have lunch, then you may have some procedures, scopies, biopsies, interventions. You finish all of that, and then your evening OPD starts, which sometimes becomes night OPD. You come back home late, you catch up with your family for a bit, have dinner, and sleep. And the next day, the whole thing starts over again. This continues every day, even on Sundays. You are never really off work. So as a doctor, I have a question for you. When was the last time you took time out for yourself? So imagining even in this busy schedule, you somehow managed to take time out for a vacation. What does the term work-life balance even mean? So let's talk about that first word first. Let's talk about work. How long have we been working? We've actually been working ever since we decided to become doctors. And so, of course, we are proud of this identity. We hold on to that identity of becoming a doctor. We've actually been working ever since we decided to become doctors. Since the time we took that exam to join medical college. Because you see, our identity was always very clear. We were bright students, good at studies. Our parents and our family were proud that we were going to become doctors, and we liked giving exams. And so in short, we never stopped working because we never stopped identifying as a doctor. So that's the work part. If all we do is work, it's difficult to talk about work-life balance. So let's talk about the second word now, the life part. If you were to look back on the memories of your childhood, you would remember many things that you tried out. We call those things as hobbies. But because of the way that our academic life is structured, we don't give the same kind of importance to our hobbies. Following our hobbies or finding our passions are as important as giving time to your professional life. And the reason for this is a word that we've already talked about, identity. I want you to think of identity as you would think of finances. Now imagine if your entire income were to come from one source. Would that be something you want? Or would you want multiple sources of income? And what would your chartered accountant say if they found out that all of your savings go into just one investment? Would they agree, or would they advise you to split your savings into multiple forms of investment, both for safety and for future growth? Now think of the same points in terms of your identity, because your identity or who you are is not a one-word answer. It is a multi-layered story with side plots and twists. Your identity doesn't come from just one achievement. You may have one main label, just like you may have one main source of income, but that doesn't mean that there aren't other important contributors. So that is the why of it. Why is it important to give time to your other hobbies and passions? Now let's talk about the how. Step 1 would be self-awareness. Just understanding your own priorities and acknowledging that there are other things that you would have liked to give time for. For me, I always used to like writing poetry, and it was a challenge to take time out from my busy schedule as an MD medicine resident and still go for poetry events or even perform in different festivals like Kala Goda. But I'm very glad that I could manage to do that at that time because it helped me remain calm. Step 2 would be setting boundaries and learning to say no. A doctor's work life is like the mythical fish avatar of Lord Vishnu. It would keep growing to fill whatever size of container you put it in. Just like that, a doctor could be as busy as they want to be. We as doctors don't really have a 9 to 5 job. There is no punch in and punch out. So there are no inherent breaks in this system. Step 3 would be time allocation for your other interests. I am a big believer in the idea that if it is not in your calendar, it is not going to happen. Just setting apart time for your other interests would increase the chances that you would do it, especially if you respect that time. Make sure that nothing else takes precedence over this. Step 4 would be involving community. Now, using community is a highly underrated advantage that we can have. especially if that community is people we already know. Try to involve your partner, your family, and your friends in the things that you would like to do. During the pandemic, me and some of my neurology colleagues found that we all like to play badminton, and we started getting into this habit of playing badminton once every 1 or 2 weeks. And I'm very happy to say that that is something we still continue to do whenever possible. And that habit is one that I'm very grateful for. And finally, step 5 would be to take your time with this change. Our working habits have been formed over many years, and it will take time for that pattern to change. Be patient with yourself, be honest about how your priorities have changed, and that shift will gradually happen. I hope this conversation has helped you all. I wish all of us all the best to make our lives more fulfilling, more balanced, and more healthy. Bye everyone, take care.